you have to go and you have to understand. Okay, so first of all, let's start with the heart itself. Okay, heart is very nice thing. I really like it, and let's take a look about the heart. I will try to show you a beating heart. Okay, so it will be a little bit fascinating for all of you, I guess. So let's see. Okay, can you see that? The beating heart. And so we have to know about the normal anatomy of the heart, because in our exam they will ask you very simple, very simplified way. They will ask you the questions about the heart, the anatomy of the heart. They have some images and they will ask you the questions from that images only. Okay, so you can unmute yourself. Okay, because this is a short class, so let's discuss this. Okay, so first of all, as overall, what you are seeing here, the heart, right? And their branches, their trunks, and the arch of aorta, the superior vena cava, all of those things you can clearly see. So let me just try to rotate this. So it was the anterior surface, and if I go to the back, then you can see from the posterior aspect as well. So let's try to look at it one by one. So if you can see this is the mainly
Right.
the ventricular. Yes, mainly you are seeing from the anterior aspect, you are seeing the ventricles, right? It's like difficult to look the atriums from this. So if I go to the back, then you can have the atrium as well. Okay, the right atrium, then the auricle, and also if I can go like this, then you can have the part of the left auricle. Okay, this is the left auricle, and also you can have the left atrium as well. On the inferior aspect, if you can see, this will be your right ventricle, and also this will be your left ventricle as well. Okay, here is the right atrium, inferior of the right atrium, you can have the inferior vena cava, and above you can have the superior vena cava as well. Okay, and on the back of the atrium, the right atrium, you can have this the circular one. What you can see the circular four pulmonary
Full pulmonary trunk. This is the upper
Veins.
Yes, this is the pulmonary, four pulmonary veins, and this is the pulmonary trunk. Okay, this is the pulmonary trunk. Also, this is your ascending aorta. Okay, this is the arch of the aorta, and if you can see, there is a circular area, right? Yes, this is very important. Okay, and there is a question. There is a question, the branches of the ascending aorta. So the branches of the ascending aorta is only the right and left coronary arteries, and that are arising from the aortic sinus. Okay, so please remember about the branches of the ascending aorta. It's only the right and left coronary artery, because in the exam, because of the stress, you might forget about that, and that's why I'm trying to show you. Okay, is it all right about the outer surface for all of you?
Yes,
Okay,
sir.
if it's clear, then let's try to see inside. Okay, so if we can see in the inside, first of all, what are the things you have to know? You have to know about the valves. Okay, this is on the right aspect, right? This is on the right aspect. So you are expecting to have the tricuspid valve. Okay, why this is a tricuspid valve? Because you can see there are three cusp, the three leaflets. Okay, the right one, the left one, and in the below as well. Okay, so this is the tricuspid valve. Okay, and what is attaching with the tricuspid valve? As you can see,
40 tendini.
Yes. So these are the chorda tendineae of the tricuspid valve, and the chorda tendineae is attaching with the papillary muscle. Okay. So inside of the heart, is it clear? On the right aspect, we are having the tricuspid valve, the chorda tendineae, and the papillary muscle. Okay. Also, like inside of the right ventricle, the walls, you can see the trabeculae as well. Okay, but this is not been, yes, this is not been asked before. Okay. Next, if it is clear about the tricuspid, so in the one more thing you can see from this is the
Pulmonary
valve for
semilunar valves.
yes, these are the
Pulmonary valve.
pulmonary valve. Yes. So
Pulmonary.
just remember all the valves. Okay, all the valves are mainly three, except the bicuspid
Mitral.
one, which is the mitral one. Okay, all of them are three except the mitral one, which will be on the left hand side, the atrioventricular, the left atrioventricular. Okay, so this is the pulmonary valve itself. Okay, so from the right hand side we can see two valves. Okay, so if why I'm showing this to you, because I want you have to know the exact location of those valves, because you need to auscultate as well about those areas, right?
Yes.
Remember, you have to auscultate those into different areas. So about the pulmonary valves, where you are going to auscultate?
Left second ICS.
Yes, on the left second intercostal space, as you can see here clearly, right?
Yeah.
This is the pulmonary valve. Here you can auscultate for the pulmonary one. Okay. About the tricuspid one, where you are going to auscultate?
Left fourth.
Fourth.
Where?
Left fourth.
On the left fourth. Yes.
Parasternal border.
Yes, on the left fourth here. Along with this view, you can see this one, about the tricuspid one. Okay. Is it clear about these two valves, their location, the pulmonary, the leaflets, and all of those things? Is it clear?
Yes, sir.
Just you have to know a very simple way, and you have to have a very clear idea about that as well. Okay. So there is another question is, what is the vertebral level of the pulmonary valve? Okay. It is about the pulmonary valve. What is the
P6
level? Okay. So let's try to see. So I'm assuming, okay, this is this one. So you can see this is at the level of sixth, sixth thoracic. Okay. So this is T6. Okay. And again, you have to know about the vertebral level of the pulmonary trunk division. Okay, so in this picture it is at the level of T5. But normally it should be, I cannot show.
T4.
One second please. Okay, now I think it will be a little bit clear for all of you. Okay, so if you can see the pulmonary trunk, if it bifurcates at the level of mainly T4. Okay, at the level of T4. Okay, is it clear about these two things? Pulmonary bifurcation at the level of T4, and the valve is at the level of T6. Okay, and I think no one can show you much more clearly in a beating heart as well. Okay. All right, let's this is about on the right hand aspect. Okay, what you have to know. So let's try to show you the left hand side. So here, this is you are seeing the bicuspid one. Okay, the mitral valve, or you can say also, sorry,
No, this is bicuspid left atrioventricular valve, no?
Yes, this is the
Car-
bicuspid, or you can say the mitral one as well, right?
Mitral. Yeah.
Okay. Also, there are a few other things you have to know from this. One is, again, what is connected with it, the chordae tendineae as well, and also the papillary muscle. The papillary muscle here are different. Okay, so the papillary muscle are few there are some of the anterior papillary muscle, there are some posterior papillary muscle. Okay, so in a cadaveric image, the location you have to say by their location. Okay, so here you can see the superior one. So if I can locate the inferior one, you can see the inferior one, inferior papillary muscle as well. Okay, so the same thing, but you have to be very much specific for the answers. Okay, then it will be nice. Okay, and what you are looking, I think if I can show you, yes. Okay, this valve is, yes, this is the aortic valve. Also this valve is there are three leaflets. Okay, there are three leaflets. Okay, so if I ask you how many cusps are there in case of the aortic and also in case of the pulmonary valve, so there are three cusps. Three cusps. Okay, what about the tricuspid? Also the three. And what about the bicuspid, or the the left atrioventricular? That is bicuspid, and that's why it is known as the mitral one. Okay, so is it clear? Because in the exam, you will have a little bit difficulty to understand all this. Okay, so if I want to ask where you are going to auscultate the apex, okay, where you are going to auscultate the apex?
Left fifth ICS in the
left fifth interstitial space in mid-clavicular line.
Fantastic. Okay. What about the where you are going to auscultate the mitral valve?
Left fifth ICS in the mid-clavicular line.
Sorry?
Left fifth ICS mid-clavicular line.
Yes, yes, yes. About the mitral valve, yes. But always remember, when you are auscultating the mitral valve in the clinical exam, try to ask the patient, can you bend on your left hand side, please? So you need to do the accentuation in the clinical exam when you are listening to the heartbeats. Okay. About the aortic one, you need to ask the patient, can you lean forward for the accentuation of the sounds as well? Okay. So please keep those things in your mind while doing auscultation in the clinical examination. Okay, but not in, it is not necessary in case of the anatomy, but I'm just giving you the heads up.
I think, is there any necessity to say breath holding expiration or something like this?
In case of
hold your breath after expiration
in case of the valve, yes.
Accentuation.
Yes, you have to. All of those things I will say what are the things, what are the steps you need to follow, all those things in the clinical examination. Okay.
Yeah, right. Okay. Fine. Thank you.
All right. So about the branches, I think all of you know about the aortic arch branches, all of those things all of you already know, and these are the basics. Okay, I think now it's a little bit clear about the heart, right? So let's see what kind of picture they can show you. So this is the picture of what we talked about. Okay, so let's try to simplify this as we did. So first of all, let's talk about from the right hand side. Okay, so number 4, this will be the right. Sorry, this is the right auricle. Okay, this is the right auricle. Okay, next you have to look, or you have to have the visualization about, it is the cut section, the way I did, right? The same thing. Okay, so if I can ask you what you are seeing, This is number 8. This is the tricuspid.
The tricuspid valve.
Mainly, you can say this is the tricuspid valve. Okay, this is the tricuspid valve. Okay, if I can ask you, what are those? These are the chorda tendini. Okay, and also
Chorda
about the
tendini.
number 9, these are the papillary
Papillary
muscles. Okay, if I ask you what is this in the same, okay, on this aspect, these are the chorda tendini as well, and these are the papillary muscles, but it is on the anterior aspect, so you can say these are the anterior papillary muscles and these are the posterior papillary muscles. Okay, also they can ask what you are seeing, what is this valve, okay, which is number 24. So you can say number 24, this is the interventricular septum. Okay, all right. Let's try to look more. So on the right hand side, I showed you 2 valves, right? One was the right atrioventricular and another one was
Left atrioventricular.
The pulmonary valves.
the pulmonary valves. The pulmonary valves, right? But here they cut this area. See, there is a square cut in this picture to show you the
aortic
valve.
valve.
Yes, the valve on the left hand side. So this is, okay, this is specific for this picture. So this is the aortic, okay, this is the aortic valve. All right, next, what we have to know, let's try to look up. Okay, so this is number 16. This is a very simple thing.
Ascending
This is the
aorta.
ascending
Aorta.
aorta. Yes, very good. And also you have to know about this. Okay, this is
Pulmonary trunk.
the pulmonary
trunk.
fantastic. This is the pulmonary trunk. Also, this was the this area was the right auricle. So you can see this is also
The left aorta.
Left auricle.
the left auricle. Okay, and also what you have to know more, the ascending aorta, then it should be the arch
Arch of the aorta.
of the aorta. This should be the descending. Okay, and also the branches from the arch of the aorta. So number 1, it should be
Right brachiocephalic.
the brachiocephalic trunk. Then it is
Common carotid.
Left
Common carotid.
the left common carotid. Okay, and this is
Left subclavian.
left subclavian. Okay, fantastic. And what we have in this picture left, so we have something, this, right?
This is left pulmonary vein.
Yes, this is the left pulmonary vein. And yeah, I think we have covered all of the things in this picture. Is it clear?
Sir, what is 20?
Number 20 should be the pulmonary valve. This should be because it's on the right hand side. Okay, this should be the pulmonary valve itself. Okay, and they have cut this area to show the aortic valve, and this should be the pulmonary valve. Okay, above it. All right.